Hi, Jamie.
Hi, Brooke.
How are you?
I'm good. I'm excited to be here.
Me too. I'm really excited. So today, everybody, I have Jamie Sanborn, owner of OneElevenRX.
Yes.
And I actually had the pleasure of hearing Jamie speak at Elevate Her, which is a really cool event in Worcester this Saturday. And I learned so much about your story. And what I really took from your story, too, is like the pivots you made in your career, which I think is so critical, and we're seeing it kind of more happen in the healthcare world too. So I'd love for you to first start just by sharing a little bit about yourself and about OneElevenRX, and then we'll dive in.
Yeah, sounds good. So my name is Jamie. I've been a registered nurse for, do I dare say, like 15 years.
Isn't it wild when you think about that?
I don't know where that time went.
I know. Tell me about it.
But yeah, I started out on the same path most people do in a hospital, and I did all kinds of different work. But I found myself working my way into operations in a hospital, and I did that for years, which I think was a really great foundation, as I built the med spa. But, prior to that, I was a nurse, and I started doing spray tans because I couldn't believe that as a nurse I wasn't making and meat. So
The cute little doggy's here. That's Jamie's cute little dog.
who's crying. So
She needs mommy.
yeah, she needs mommy. So I basically realized very quickly that although everyone says nursing is such a great career, I wasn't making enough money to really survive and make ends meet. So I decided that we just had to pivot. We basically had to figure out a way that we were going to be able to make ends meet and not be struggling. So I knew I wanted to be in the healthcare space, but I also love the beauty space. So I started spray tanning. I went and I called my dad and I asked him for a loan on some spray tan equipment, and he laughed at me and told me that I shouldn't do that because it's a waste of money. And, fast forward to just a few years later when I was doing like 20 spray tans a day in my back bedroom of my house, he wasn't really laughing anymore. So we eventually got a space, and from there, we just started adding one service after another. And at that time, in 2019, Botox was really just kind of making it to the scene. So that's kind of how it started. And then from there, we turned kind of from spray tan business to med spa.
I love that. I mean, that's great. And you've created something so special. Like, it's so unique. Like, I've done my fair share of going to other people. And I think that, your space is great. All of your girls are wonderful. And you've really built something really special.
Thank you.
So on that, I want to really talk about, I feel like a lot of people are going to look at this title and they're going to see Jamie Sanborn and OneElevenRX, and they're going to think that this is about cosmetic injectables. And we're actually pivoting. We're busting a myth right now.
Yes.
That neurotoxins, and there are such a other plethora of therapeutic interventions that you can offer. And I want to start there. So what are like therapeutic neurotoxins? What else besides Botox can you use, for really helping people with recovery?
Yeah, so I think when we look at Botox, it is a medication. It was developed back in the 80s, I believe, for strabismus, which is being cross-eyed. Okay. So it did start out with a therapeutic indication.
I didn't know that.
Yeah, so that's pretty interesting. And I mean, there are so many ways that it's used now. I know a big one that a lot of people know about is migraines. So people will go into usually their neurologist, and they'll get treated strategically to help release the tension to help with migraines. So that's a big one. And we also found out that it can help to reduce sweating, right? So underarm sweating, when we have hyperhidrosis, the body is just producing too much sweat. So we can shut those glands down by using Botox. We use it, another therapeutic way is the masseters. So our masseter muscles, a lot of us tend to overuse them, grind our teeth. We get nervous, we clench, stress. And that can carry through into the trapezius muscles too. But what we do is we Botox the masseter muscle and sometimes the traps as well to just settle that muscle down. You don't need that much of that muscle to be working all the time to the overuse. So basically we treat it and it hypertrophies slightly so that we don't have so much muscle going there. And that's kind of where the benefit comes from. So you're not so overactive.
Yeah.
A really great use, one of my favorites, overactive bladder. They inject it in the bladder.
Really?
The bladder relaxes so you're not having those issues. Yeah, like there's a lot contractures after a stroke when someone's arm or leg or whatever
I heard that.
is contracted. They use it to release and relax those muscles so that person has a little more range of motion with those ADLs. So I mean,
love that.
There are really like a lot of different ways we can use it therapeutically. To be honest, I mean, it's pretty much just the face where we're using it cosmetically. So
Absolutely.
Yeah.
I love that. I don't think a lot of people know this about me, but I'm a speech pathologist neurologist. So, and I worked in the adult space, and I work with a lot of people who had strokes, who also had something called spasmodic dysphonia.
Okay.
And you can actually inject Botox into the vocal cords.
That's amazing. I don't think I've ever heard that, Brooke.
Yeah.
That's really cool.
Super cool.
Yeah.
So there's so many other things, right? Outside of like the use of Botox, what are some other interventions that you feel like, you know, people should know about, and kind of things that, you know, I'm kind of foreshadowing here, but what we're going to be using here too in our cool little collab that we're doing on April 10th. What are some other interventions that are really beneficial?
So I think something that we've seen in the last couple of years in the med spa space, and this has been really interesting, is that we're kind of seeing that crossover from the med spa space moving into the wellness realm.
For sure.
So there's a lot more functional medicine happening. I even would go as far as to say that there's a lot more like even primary care wellness being done just like inside the med spas. So some of the things that I can see our two businesses really thriving, offering would be IV therapy, because if you're having patients coming in and they're working on the muscles and, you know, they're trying to like just feel better, flush things out of their body, I think IV therapy could be a huge benefit to some of your patients. NAD injections, that's going to work on the body on a cellular level, really preventing aging. So I think that's huge for recovery.
And what does NAD stand for? Can you talk a little bit more about that?
Oh my gosh, you're going to put me on the spot.
Oh, no.
Yes, it is. No,
Don't have
I
it
just
memorized.
always say this wrong. It's nicotinamide adenine, and the D stands for something. But yeah, it's a pretty long word, and basically it is the building block of all of our cells. It has a function as a building block in all of our cells. So when it's injected, we're basically allowing the body to repair on a cellular level with the cells that function using NAD.
Cool.
So it's really neat. I think that has been a really great way for people to recover and just prevent aging. So that's a big one. B12 shots, I think, are great. Those are great for energy, even allergies. I mean, those are a really good, probably underutilized injection as well of vitamins.
Absolutely.
So I think your patients might like those. Let me think what else. I think those are probably the big ones. We do have in the IV bags, like we can really utilize those to be patient specific. So depending on what they're going through, I think that we can really make that like tailored to what their concerns are.
Yeah, I love that. That's very in line with what we do. You know, we're not like that cookie cutter approach. You know, we really want to make sure that we're treating the whole patient, that holistic model, that total body wellness. And each person is different, right? What may work for you is not going to work for me.
Right.
And my symptoms may present to a different pattern than the person next to me and what they're being treated for.
Exactly.
And I want to like pivot and kind of talk about that a lot, because I think, you know, as healthcare professionals, and I'm sure in your space you see this too, people think that you just treat a symptom when in fact you're treating a pattern.
Right.
And all those like therapeutic neurotoxins and NAD and all those other things kind of usually treat patterns, not just a symptom. And I'm thinking specifically like about TMJ, right? A lot of people who have TMJ also have cervical issues and they have headaches. So we're treating those patterns of what we're seeing caused instead of just the symptom itself, which is usually pain.
Correct.
Right? Can you talk a little bit more about that? Like what patterns do you usually see in patients that may benefit for things like this?
Yeah, so honestly, like I find that a lot of times when people come in, they're generally looking for cosmetic work.
Of course.
But sometimes after getting into a conversation, we realize that maybe some other things should be dealt with first.
Right.
And I mean, even taking it a step further than like just the pattern, it's almost a lack of pattern that I see. It's a lack of that self-care. It's a lack of, you know, eating well, drinking well, sleeping well. So sometimes I think before we even get into these like problems we're having, I think we miss some of the basic things we could be addressing, if that makes sense. Like, and I'll take this just in a little cosmetic group, but sometimes people will be like, oh, I have a line right here. And I'm like, well, let's talk about your water intake, because that looks like dehydration to me.
I love
right?
that.
So like,
Yeah.
I think that we see, you know, I notice it the most in the cosmetic patients because I see the most of those, but I think that we see the pattern of Americans not taking care of themselves, wanting a one and done treatment and not really addressing the underlying issues.
Yep.
So I would say those are the big ones, not starting at point A. Like,
Yeah, absolutely. That leads us into like the bigger conversation around this too, you know, about how, especially here in the United States, we're not getting what we need from our healthcare system that we actually need. And you touched a little bit about like that individualized care, and we talked about that, and you know, the healthcare industry, you know, the people who are really doing it right, do I dare say that?
Right.
Are really moving into also being able to partner with wellness. And there's a reason for that, right? You touched on that so nicely. Somebody coming in for something cosmetic, they don't like a line on their face, and you're like, well, do you drink water?
Right.
You know,
You might not need Botox. Like, let's talk about what you drank for water today.
correct. You know, it's not, you don't want to go, it's the same bigger conversation. Like, you don't want to go to your doctor and you're like, I have back pain. And they're like, okay, here's a script.
Right.
Well, but
it's not
what's
solving the issue.
Correct. Like, what's the root cause? Like, what are we looking at here? So, you know, in this population that we feel like we're so underserved here in the United States, the way that we do healthcare, you know, how do you really feel like a partnership with wellness and healthcare? What do you think really that looks like, and what does success mean in that partnership?
I think that's such a great question. I think it actually dovetails on what you just said. Like, if we're to be successful, I think we have to start at the beginning. And I think healthcare in our country is very fragmented. You have a GI doctor, you have an allergist, you have your med spa, you have your primary. And I think we're seeing the primary care not being the nucleus really any longer in the way that we traditionally saw it. I think we see primary care, like I see so many NPs opening primary functional wellness clinics, and I'm like, that is something we need. Like, that I think is where we're going to find success, because unfortunately our healthcare system is very much run by insurance companies and, you know, big pharma, and a lot of things that make it hard to get very personalized, affordable care. So I think this wellness space is honestly, I think that people have found this space because we didn't have it, right? So I think the people that are driving this forward are looking at it that way, and I think that's where we're going to find success, is bringing it back to being about the patient. Maybe it's smaller clinics led by nurse practitioners, maybe not MDs, and maybe it's those private pay models where you pay like a subscription and you're able to get your care from someone who answers the phone and is able to answer your questions and not send you to 4 specialists before you get an answer. So I think that's where I see it moving.
Yeah. We've not recently, but we have recently been expanding, you know, some of our additional services that we offer our patients that are not covered by insurance, and not that we are an insurance-based practice, but there's insurance limits what we can do.
Right.
You know, something like dry needling, which our physical therapists love to do, and there's so much benefit to the patient. I can tell you that if I have something happening and I'm just in pain and it's muscular, and my husband, who is a physical therapist at home, dry needles, I mean, it is fixed in 30 seconds.
Right.
And that's not covered by insurance.
Right.
So in order to truly care for our patient and care in the way where we can really embody that total body holistic approach, we have to have some cash-based offering.
Right.
And I think you bring up a good point that, you know, being able to offer some of those things really allows you to be able to treat the whole person.
Correct.
You know,
and
not
I think
just a symptom.
I think to your point about, you know, like the dry needling that you just choose to do on your own time because it's not covered. It's like, well, and even if it was, are you going to have to try 4 other modalities before that's approved? So I think sometimes our insurance-based systems just either limit us, or they put you through so many other hoops that it just takes so much longer to get to that final goal.
Absolutely. Yeah, we're seeing a lot of cash-based even PT practices coming up now because it's just hard to provide that, like, you know, really that care that your patient wants when, you know, insurance reimbursement is, I mean, this is not even joke, like $70 for a PT visit for PTs who went to school for 6, sometimes 7 years, have doctorate degrees. Like, that's bananas. And, you know, we're all healthcare professionals here, so we're all here for the patient.
Right.
But it is cool that we have these opportunities, and I love the way that, like, the industry is going. And, you know, like I said, like I dared to say, you know, the people who are doing it right are really capitalizing on that.
Yeah. And I think something you guys are doing really nicely here is you're thinking outside the box. You have a sauna, you have cold plunge. You're thinking of things that are going to benefit your patients as a whole, like not just treating the physical therapy and saying, you know, like you should go here and do this, or you should go do that. You're literally putting it all inside one location or multiple where they can go where it's most convenient for them and they can get these treatments, and really just keeping it whole and like keeping that patient at the center of that care.
Absolutely. Yeah. And let's talk about, like, you know, those specific patients that like really benefit from this. You know, of course, I could probably stay here and for hours and talk about how every single person could benefit from this type of integrated medicine. But let's talk about like our active adults, you know, our are high performing, active adults who, really are trying to elevate and have that integrated performance medicine as part of their care. Who is that ideal patient? And if you were able to prescribe something so specific for them, and I know, I'm giving you like a big, broad patient to kind of describe, but who would that be? Like, who's that ideal person that would come in, get PT, and then also have some therapeutic, type of interventions as well?
Honestly, I would say the patient that is concerned about their quality of life, their, how they want to age. I think that what we do today really sets us up for a more graceful aging. And when I say aging, I'm not even talking cosmetically at this point. I'm talking about the body. Like, I think the person that would be benefiting from these services are both involved and invested in how they look and how they feel. So outer and inner.
Absolutely.
And I think it's people, honestly, that see value in things and don't just look at the dollar sign. I think, some of these services could be pricey, especially in my office. And I think that if you want results, like, this is just the things you have to do. So I think it's people who see they're looking for value and quality in these treatments, not just a deal. And I also think people that want to take care of their body physically, inner and outer.
Absolutely. Yeah. What is that saying? Like, you are as good as you feel. Like, you look as good as you feel.
Exactly.
It's so true. So for like some of these therapeutic interventions, what can people expect? Like, is it going to hurt?
Right.
How are they going to feel after? Can you talk a little bit about that for like each type of therapeutic injectable or IVs or whatever additional therapies you're able to offer?
Yeah, I think that with most of these services, they're so quick and easy. And one thing I hear from patients all the time is they look up and they go, "You're done? That's it?" And I'm like, yeah, that was it. Like, the consultation takes me twice as long as the injections generally. So I would say with B12 shots, it's literally a shot in your arm or in your booty, whichever one you prefer. You have better absorption in the glute. So I always try to go for the glute. Those are quick and easy. Your IV therapy, thankfully, all the girls in the office are a really good stick. So it's usually one and done. And those are really easy to, I know a lot of people think when you get an IV, the needle's in your body, but it's not. It's just a little piece of plastic delivering that medication. So we love that. So you can kind of bend your arm, move around.
Yeah.
Botox, a few pokes. Usually most people treat their upper face. You can treat lower face too, but usually it's like, 10 pokes in the forehead or so, quick and easy. The needle's about the size of an eyelash, so it's very comfortable. And then for downtime, really not much. The only thing you'd have downtime with is Botox. You just can't work out for 24 hours. And that's kind of the long and the short of it. We also, one thing we haven't touched on yet is the weight loss too. We can offer weight loss to our patients as well. And I think kind of going back to what you were touching on before, the patients that would benefit from this, I think, again, quality of life. So like with weight loss and really making sure that our bodies and our skeletal units can handle like what we're putting on it. Yeah. And with that too, that's a weekly injection. So kind of same as the other ones we were discussing. That wouldn't be too much or no downtime at all.
Yeah. I love the quality of life thing because that is everything, right? And we talk about that a lot here too. It's not just about, my knee hurts or, I have neck pain, I have pain, like I need to come in. It's about, well, what were you doing before that is limiting, that you are limited by now? And how can we get you there? And how can we get you there faster? So you can pick up your grandchild again. You can, go for your run in the morning that, makes you feel zen and just like you again. So
totally,
that's really the quality of life conversation. And I feel like a lot of practitioners forget about that. They see the body part or they see the, the symptom of it and they forget the function, which is the quality of life piece.
I agree. And again, kind of going back to what we were talking about before, but I think when we look at like the patterns and the symptoms of what leads people to these different treatments. So if someone comes in and they have a sore knee and they're 300 pounds, are we just going to not talk about the fact that this person's skeleton is probably not built to carry around an additional 150 pounds? Like sometimes I think that that's like the basis, right? 100%. That's the underlying issue. So, and I know these are hard conversations, right? I have them with my patients too. And I think that sometimes we just we need to talk about the things that can change in order for the quality of life to improve.
Right. Yeah. And when I always say, I think sometimes people get it stuck in their head that maybe the patient knows, but a lot of the times the patient doesn't know.
Right.
And it is up to us as healthcare providers to educate our patients on all of their options. Wouldn't we be doing them a disservice?
100%.
We didn't have maybe an uncomfortable conversation or we didn't offer them all of the things that we knew was going to help them. And yes, maybe some of it comes at a cost, but that's for them to decide.
Yeah.
We need to do them that service that we all signed up to do, to advocate for our patients, and I'd be able to offer them.
There's a really nice way to do it too. You don't have to make them feel bad. You don't have to be rude about it. I think there's a really nice way to deliver some difficult conversations that really have positive outcomes for the patient on the other side. Because to your point, a lot of them don't know. You're right.
Yeah.
They just don't see it.
No,
So.
they don't. Let's go the opposite side now. So we talked about, the patients that would really benefit from these types of services coupled with their PT. What are some of the patients that may want to wait to have that? And we have that too, right? You have patients that come to us and, we, have to pivot what we're doing.
Yes.
What are some of those patients for you?
I mean, a lot of people come into my office thinking that they're coming in for one service, but after we get to talking about their goals and what they want the outcomes to be, we end up doing a very different service. I think, especially in the med spa space, I don't expect my patients to know what service is what and what they're talking about. So it's actually an interesting conversation on the business side too, like with booking. Do we put all the services out there or just have them come in for the consult? Because sometimes, and not really, sometimes all the time, it's our job to tell the patient what they need, not the patient's job to tell us. So I think sometimes people come in and they're like, oh, I'm here for, say, under eye filler. And I'm like, okay, well, looking at your anatomy, you're not going to be a candidate. So let's pivot and do something different. We'll do something more like PRP, where we're going to use your body's own blood and components, and we're not going to give you a negative outcome. I think and really asking the questions to understand what it is that they're looking for, because I could just look at the schedule and be like, okay, under eye filler, and give them what it is that they're asking for, but that's not what they need.
Yeah.
And I think that when you tell your patient no, when you guide them through this journey, the trust blossoms. It really just grows, and you've developed a rapport with that patient, and they're like, wow, she's not just trying to make money off of me.
Right.
This is truly what benefited me more.
It's personalized care.
Yeah. Yep, absolutely. So I think even though sometimes we are talking about it from the cosmetic side, I think we still face a lot of those obstacles. And my goal and job at the end of the day is to keep the patient safe.
Right.
Period.
Absolutely. Yeah. So on April 10th, we're doing our first official collab.
Yes.
And this is something that we're really excited to kind of keep going.
Yeah.
And here at Concierge Physical Therapy, we're going to really offer that in our memberships as well, although to all of our patients.
Yes.
So some of our patients might be seeing this prior to us actually really going live with that collab. So what does April 10th kind of look like to you? Can you tell our patients a little bit about that and what your girls will be coming here to do?
Yeah, absolutely. Well, first of all, we're so excited. We're really empowered, excited for just a high level collaboration that's really going to benefit Concierge and 111. So on April 10th, I will come here with my nurse, Caitlin Caplet. She is wonderful and almost a nurse practitioner. We couldn't be more proud of this girl. So she's wonderful, and she's really into the functional wellness side of aesthetics and medicine in general. So that's where she really wants to land after she's done school. So I thought it would be a really good partnership to have her be the nurse that does this. So we'll come in. We have online booking set up. So if people go to the OneElevenRX website, or I can provide our phone number, they can sign up for an appointment, whatever appointment they want, pick their time slot, and we will come with everything prepared. So we'll bring the IVs, we'll bring the vitamins, we'll bring the Botox, whatever everyone signs up for, and we'll be here to answer questions, go over anything everyone needs, and just really go from there, see how it goes, and tweak it as we need going forward.
Great. So when someone goes to that website, which looks so great, by the way, everybody.
Thank you.
I already visited it. It looks awesome. When someone goes to that website, if they have a question about the services that are being offered, a specific question as to what may work for them or not, I know you guys can do that day of.
Yeah.
But also, what would be the best way for them to ask that question?
So we have a little help tool right on our website to ask a question or to contact us. So you can kind of leave your blurb right there, and we'll see it come through and can get back to that patient. Or I can provide the phone number, and you can call us, text us. Someone always has that phone. So we're able to answer any questions.
Great. And if they come that day and they sign up for a service, are they getting charged right away? Are they getting charged after the service? And where I'm saying that is, can they pivot when they come? Can they be like, oh, I thought I wanted to do this, but actually talking to you more, I think I want to do this.
Yeah, absolutely. So there won't be any we or anything required beforehand. We just put a card on file in case there was a no-show. And then from there, you can do whatever you want. We'll bring extras of things. And, we kind of talked about, things change in the appointment. So we'll just kind of be prepared to work with anybody who, wants whatever. And I think as we refine it, we'll know, we probably need 20 B12 shots. You probably need, 10 of these. So I think we'll know better going forward, but we'll be prepared. I'll bring plenty of extras for whatever your people want.
Awesome. We're really excited about this. And I think this really, sets, us apart and 111 apart from really doing this really cool partnership and really being, in my mind, the leaders in this kind of, movement forward of medicine really being functional, performance, and integrated and partnering within the healthcare industry. Like
That's what I was
doesn't
going to say.
happen all the time.
Yeah. And honestly, I love that this is kind of like two unlikely businesses, but really when you break it down, it is a likely combination. It's just, I haven't seen it yet, so I'm very excited about it.
Well, we're going to be the first. We're going to set a trend.
Yes, and we're excited to be here.
Setting a trend.
That's right. I love it. I love it. It's going to be awesome.
See that for us.
Me too.
Right?
Totally.
I mean, you're already doing it.
So are you. You guys have 5 locations.
Not me, but like Sean and Concierge PT. I'm just like in the back end.
Hey, you make it run. That's it.
We try.
He's the face, but you're the neck. You turn the head.
I love
That's
that.
it. Yeah.
Yes. I got to say that to him later.
Yes, you do. Don't put that on there. Save that for you.
But I'm the neck, okay? I'm like taking it. So wherever you need to go, I'm moving it.
Yeah, that's right.
That. So we're really excited about April 10th. More to come for our patients.
Yes, absolutely.
And we'll be rolling that out. Our team is doing a training with you this Friday, which we're super excited about. So thank you for that.
Of course.
Our PTs are going to be well informed and educated and have all the evidence to back it up.
Right.
So again, thank you, Jamie. I really appreciate you. And I'm so excited for this. And I couldn't have found a better partner to do this with. So
same. I'm very grateful, and we're really looking forward to it. We're going to make this everything you guys want. So
I love it.
Yeah.
Thanks for bringing my cute little doggy.
Oh, thank you. We finally settled down.